Good morning, dear colleagues. Thank you for the organizers for a possibility to share with you my experience in working out and implementing of a model of personalized precision medicine being based on design-driven bioengineering and to be implemented into the daily clinical practice. Unfortunately, this is died. It's a fantastic person, number one in the area of immunology 5 years ago, director of the Institute of Autoimmune Diseases of Johns Hopkins, and had chair of the Department of Autoimmune Disease of Harvard Medical School, my teacher, but unfortunately died. Over the course of its history, medicine and healthcare philosophy have given special attention to the already diseased individual, focusing on a type of clinically manifested disease, nosology, patient Hippocrates, rather than on one's health or the so-called pre-illness conditions, while the latter are being left in the shade. Meanwhile, 1/3 of the able-bodied population of our planet already belongs to areas of potential risk of being diseased. It's the data from London Business School, number one in the world in business education. Human malignant load. No comments, but the resources of canonical Hippocrates medicine have been missed. That's the fact. And thus the clinical efficacy, chronification, and disability rates and the human longevity must be drastically improved soon. Whilst analyzing and pre-selecting basic determinants of health was being summarized from Stanford University. To be valuable for the implementation and securing the efficacy of personalized precision medicine PPM model in the daily clinical practice, a group of the recognized experts in the PPM-related area has presented an evidence-based and well-documented assessment of global trends in medicine and healthcare development and stressed the executive value of the next step model healthcare services being entitled as personalized and precision medicine. The first lecture to your attention was presented in 2004 at Stanford University by the NIH Director General. PPM, as a new model of healthcare services, is the unique entity demonstrating an integration of fundamental clinical science, bioengineering and translational art, and IT armamentarium. And illustrating application of sets of the different tools at the population, community, and individuals. PPM is a goal of healthcare in which diagnostic and treatment decisions are informed by each personal unique clinical, basic omics, and environmental exposamics related information. The latter means that advances in molecular biology and genetics have tremendously affected the practice of general and clinical pathology, gradually transforming from systems and into a systems and molecular-based discipline. The practice of clinical cancer pathology has been substantially changed in the previous years due to the advances in molecular diagnostics and targeted treatment, as applicable to PPM, personalized precision medicine, and PPO, personalized and precision oncology. In this sense, a variety of the methodological aspects and clinical implications of key approaches that extend beyond canonical DNA-based genotyping of tissue, well established in clinical molecular cancer pathology labs. Look, it's just the overview of the latter, being based on cancer syndromes, predictive markers, circular fragments, and you see, just globally. The first is the use of information not only from individual variants, but also patterns derived from larger data sets, mutational signatures, DNA methylation, or RNA expression profiles, as well as proteomics and proteogenomics, add principally new layers of information. The first is the use of information not only from individual variants, but also patterns derived from the larger data sets as new layers of information. Look. DNA methylation and RNA expression profiles are already integrated in routine clinical for select malignancies and broad pre-early subclinical and predictive testing using comprehensive and multi-layered profiling strategies, which supports diagnostic, for instance, tumor profiling and typing, and therapy prediction at the same time, are becoming a standard in daily cancer practice. The other approach is the analysis of blood using liquid biopsies. Is described in detail with examples of both circulating tumor DNA, CT, and circulating tumor cells, CTC, applications. The third important direction of diagnostic development is the massive upscaling of data processing, data bioanalytics, necessitated by the patterns of changes and the integration of multi-layered data, offering a possibility to make better use of all bioanalytical tools. Meanwhile, most of the approved and validated, I mean FDA, diagnostic, predictive, and prognostic biomarkers in PPM and PPO still require further optimization and standardization due to the FDA rules. Look, PPM-guided cancer clinical practice does demand for optimization and standardizations for types of approaches. global types. Step number 1. Biomarkers in PPO is the crucial element in daily cancer practice. Crucial. Clinical applications of cancer biomarkers in global terms: canonical diagnostic, predictive, and prognostic in daily clinical practice. In particular, circulating biomarkers in liquids, including blood. To achieve the implementation of PPM-guided oncology concept, it's necessary to create a fundamentally new strategy based upon predictive and subclinical recognition of biomarkers, including genomics-1, of hidden abnormalities in pre-cancer conditions and pre-cancer persons at risk, long before the disease clinically manifests itself. It's just cancer pathway and crucial steps for biomarkers to be used in. There is an unmet need for novel and more reliable diagnostic, prognostic, and predictive cancer biomarker-guided tests for privacy, in particular of interactome level. It's the latest innovations in cancer. Given a low response rate and common resistance for most approved cancer-targeted treatment modalities. Just look around. PPO globally. Today, there are numerous cancer awareness campaigns that provide information on the pre-cancer detection and preventive measures using biomarkers. Through careful patient and pre-cancer persons at risk selection based on likely treatment and prognosis, the discovery of those biomarkers paved the way for PPM-guided oncology practice, including developments in molecular identification methods like genomics, transcriptomics, and proteomics, as well as upgraded cancer therapeutics to better patient outcomes and preventing cancer manifestations. The advent of PPM and PPO have marked a significant change in the study of cancer mechanisms and approaches to treating cancer. In the context of those changes, today's cancer pathology can play a fundamental role in both clinical practice and strategic cancer research. With innovative tools, cancer pathologists and practitioners, for sure, can take on a guiding role in the diagnostic therapeutic process of cancer patients and pre-cancer persons at risk, allowing the combinatorial characterization of the individual tumors in a complete way, directly making specific therapeutic decisions and guiding pharmaceutical and diagnostic development in the PPO-guided field. To really understand the impact and clinical role of PPM-guided oncology, we would have to understand the various fields of translational applications that provide the tools to exploit and practice PPM in broad sense, and genomics tools in particular. So, genomics is considered to be a set of the unique biomarkers and thus the molecular tools to probe genome for its quality and now even be tested. Four types of genome changes causing cancer. Look, please, you are much familiar with that. Meanwhile, the number of druggable tumor-specific molecular aberration has grown substantially in the past decade, with a significant survival benefit obtained from biomarker matching therapies in several cancer types. In this context, PPO and precision cancer pathology in particular has therefore become fundamental not only to inform on precise tumor diagnosis and prognosis, but also to drive therapeutic decisions in daily clinical practice. Various genomic analysis of human cancers are being incorporated into diagnostic and decision-making algorithms. So, cancer experts, including cancer practitioners and precision pathologists, continue to play an essential role in developing and implementing molecular and genomic tests in practice and communicate the results and their relevance with clinicians. Look, moreover, the introduction of large-scale tumor molecular profiling programs have revolutionized the field of personalized and precision oncology, PPO. As comprehensive genomic analysis become increasingly available in clinical settings, healthcare professionals are faced with the complex tasks of result interpretation and, for sure, translation into clinical practice. Genetic genomic testing is a type of medical test that identifies changes in chromosomes, genes, or proteins while providing information about person's genes, their products, and chromosomes. Diagnostic testing is used to identify or rule out a specific genetic or chromosome conditions. The results of a diagnostic test can influence a person's choices about health care and the management of the disorder, including cancer. Predictive and pre-symptomatic testing, rather new. Look, please. Just an example of predictive pre-symptomatic DNA testing. It's just an example. Carrier testing, rather new too. Newborn testing, very new, innovative, to identify genetic disorders or inborn cancer types that can be treated early in life, and other disorders, including monogenic and orphan diseases. It's just an overall of benefits of genetic testing. Look, please. Prenatal testing to detect changes in a fetus genes or chromosomes before birth to secure the national biosafety. Just an example. Pre-implantation testing, much complicated. Lots of problems with the church. Just an example and illustration of the latter. Economically much profitable. Pharmacogenetic tests, broadly used, can be used to predict and to target medicines to good responders or to identify whether an individual has an increased risk of a specific adverse drug reaction from a particular medicine. 4 alternatives for testing. That's the best. The importance of pharmacogenetic-based pharmacokinetic analysis in optimizing treatment outcome. In brief version, the protocol. Illustrated. So, pharmacogenomic-related testing is aimed at tailoring drug therapy at a dosage that's most appropriate for an individual cancer patient or pre-cancer persons at risk, with the potential benefits of increasing the clinical efficacy and individualized safety. It's just the illustration of the market. Very crucial element at any types of applied innovations. In cancer genetic testing market. It's a data from London Business School. The landscape of genetic testing has changed considerably with the emergence of DTC genetic testing, like type 1D diabetes. That's one of the first DTC packages, Oxford Laboratories, many years ago, 8 or 10. The latter is aimed to secure genetic risk prediction tools for a wide array of common diseases or cancer, and thus the national health stability. The market for DTC genetic testing, the growth and prognostic. In addition, approved cancer patient and pre-cancer person-at-risk outcomes with the use of the biomarker tests must consider not only increased survival or quality of life, but also improved clinical decision support and making, leading to the avoidance of unnecessary therapy. Illustrating the latter, the final step is decision. Each decision maker values the impact of their decision to use PPM and PPO on their well-being, which may not necessarily be optimal for society as a whole. It would be extremely useful to integrate data collecting from different data banks for applications such as prediction and individualization for further treatment, to thus provide more tailored measures for the patients, resulting in improved patient outcomes, reduced adverse events, and more cost-effective use of the latest healthcare and diagnostic resources, including newest diagnostic companion ones, preventive and therapeutic, targeted molecular and cellular, and related ones. Well, genes can say a lot about an individual's predisposition to a disease, but cannot reveal what's happening in cells at the proteomic related level. It means in reality. So a combination of genomic and phenotypic multi-omics biomarkers are becoming of great significance to be applied in PPO and need to be translated in the daily cancer practice. Look. Multi-omics approaches hold the promise of improving diagnostic, prognostic, and personalized treatment. To deliver on this promise of PPO, appropriate bioinformatics methods for managing, integrating, and analyzing large and complex data are necessary. For instance, AI, one of the crucial segments of bioinformatics. And you might feel that molecular profiling of tumor biopsies plays an increasingly important role not only in cancer research, but also in the clinical management of cancer patients, and now pre-cancer persons at risk. The crucial element in that is the molecular tumor board, one of the promising one at Mayo Clinic in Rochester, Minnesota. Such workflows have to various degrees been implemented in many clinical trials, clinical studies, as well as in molecular tumor boards at specialized cancer center. For example, Anderson Cancer Center in Houston, and university hospitals worldwide, covering high-dimensional multi-omics patient profiles into the tumor board, as well as the state of clinical decision support software to translate molecular findings into treatment recommendations. In this context, who will patients or persons at risk and their physicians trust to store and interpret the clinical data collected, harvested, and mined? Healthcare IT Just very brief scope of the latter. In particular, please pay attention. Telemedicine and mobile health. It's two crucial elements within the frame of this scope. And for sure, finally, cloudy technologies. It sounds like the unique one. As a result, a patient or a person at risk becomes a data carrier. Look, the average one is the source of 665 terabytes of the information. Integrating bioinformatics tools has profoundly transformed PPO by identifying essential biomarkers and molecular targets for personalized, I would stress, personalized cancer treatment. The rapid development of multi-omics technologies creates complex data sets that require robust computational methods to extract meaningful insights. PPO briefly as a source of the information using a variety of targeted technologies. Meanwhile, spatial omics technologies correlate molecular signatures within tumor microenvironment, guiding treatment strategies, including immune-mediated microenvironment. Bioinformatics integrates those technologies to establish a new standard in clinical cancer practice, thereby enhancing therapy efficacy. By mining the data accumulated, bioinformatics identifies biomarkers and molecular signatures that characterize individual tumors, guiding the selection of targeted therapies and predicting individualized treatment responses. The evolution of bioinformatics is aiming to shape the landscape of PPO, offering insights into tumor biology and facilitating personalized treatment approaches to improve patient outcomes in clinical cancer practice. Advancing multi-omics integration techniques alongside improved computational capabilities is essential for discovering new biomarkers, novel targets, and refining PPO-guided strategies. We might understand that bioinformatics, AI, machine learning, blockchain, and biostatistics will be crucial in translating those data into useful applications, leading to improved diagnosis, prediction, prognostication, and treatment. For instance, just few examples to illustrate subclinical and predictive risks. CTC. Look, please. It's the crucial biomarker of population of CTC. The role and impact of the latter. Three specific examples. Sorry. Interactomes. It's the latest innovation in cancer research. being set up for normal and pathological conditions. The latest innovation from Mayo Clinic. NBB, network-based biomarkers. I guess in a couple of years, it's a candidate for Nobel Prize winners. Companion diagnostic. Combinations of diagnostic and treatment resources. Molecular imaging. Absolutely unique. Several examples of the latest innovations of therapies. Cell therapy, in particular, the latest one, not FDA approved yet, but cancer stem cell-based specific therapy. It's the market of the future. Cancer gene therapy, being based on genomic editing resources. It's unique. Children's Hospital in Boston, Harvard Medical School. Lethal cancer in a child on 1 year. Now the child is 7 years, 7 years ago, but the court session is still against Harvard Medical School since genomic editing is against the God. But the baby is alive. It's just the market for cancer gene therapy. Cancer targeted treatment, you are much familiar. It's just the unique examples, Mayo Clinic. 11 metastatic melanoma, 3 years later. 10 changes of targeted drugs. This approach I have mentioned should be based on postulates which will change the incarnate culture and even social mentality. We are experiencing a renaissance, primarily driven by PPM-guided clinical practice and design-driven next-generation biotechnologies. And thus, the above-mentioned PPM model and tools of PPO applied would need for novel training, since the society is in a bad need of large-scale dissemination of novel systemic thinking and minding. We would need not a cancer practitioner, but a cancer-fighting artist. The best universities today for novel step education is Stanford, MIT, Munich, Heidelberg, and Cambridge University in UK. Several examples: Centers of Personalized and Cancer Medicine. One of the best, Perelman School in Philadelphia. Thank you so much for your patience.